16-month-old Elliot Rossiter has cerebral palsy. Since he got diagnosed 6 months ago, he sees specialists to help with his speech and movement. That team sees Elliot for 1 hour every 4 to 5 weeks. Elliot's mom, Kate DesRoches, says she was told he gets so little time because of a lack of therapists and the volume of patients.
It's hard to hear that in other provinces this isn't the case, but in our province it is. And yeah, it's hard when your son has to be the fault of the system.
In a statement to CBC News, Health P.E.I. says it cannot speak to Elliot's particular case. They say hundreds of children receive preschool pediatric services in Prince Edward Island. Despite the high demand for those services, therapy teams work closely with families and other health professionals to provide the best outcomes for children who need support. To get Elliot more care, Kate, Elliot, and his sister traveled to the Canadian Centre for Development in Calgary. His team saw him every day for 3 weeks, and Kate says they agreed with the goals she set out for her son. She says Elliot developed and got stronger.
And he is super capable, and he's willing to learn, and he can learn. He just needs to be given those opportunities, and Calgary was an opportunity for us.
Elliot's parents paid $4,700 to attend the center. Kate said a medical travel assistance program called Hope Air tried to help her family pay for their flights to Calgary, but Health P.E.I. denied the request because the center is a private institution. Now Kate says she feels like P.E.I. healthcare has failed them by not having financial support to help families like theirs.
I think there's 7 other families that travel out to Calgary on the island for this center. And that's solely because we don't have that care here. And it could be due to there's not a lot of kids like Elliot on the island, so there's not those resources in place, which is fine. But that's not an excuse for Health P.E.I. to not step in and want to help these families get the care they need for their kids.
Elliot's team has designed a therapy plan for him. He now has a walker, which his P.E.I. team thought wouldn't work because his movements are too unpredictable. But Kate worries the developments Elliot gained in Alberta will regress, now that he's returning to 1 appointment every 4 to 5 weeks. Kate says Elliot's P.E.I. therapists are great, but only managing her son's needs and not developing them. And she doesn't know if they will be willing to work with Elliot in the walker.
We do his therapy at home and everything, but I am not a professional. I can only do what I'm told.
Health P.E.I. says they would want to provide more supports to families if and when possible. As a small province, however, there can be challenges with growing certain services. Ongoing efforts have been focused on continuing to grow and expand preschool pediatric services to continue to support islanders in need. Taylor O'Brien, CBC News, Miscouche.